Twin Delivery Protocol by Richelle Jolly, midwife in Spanish Fork, Utah, gave us this. And so this is just an idea of what she does for her twin births. Now, the reason I'm sharing this and the reason I added it to our manual is because in a low resource unexpected childbirth, you could have twins, you could have breech baby, or you could have other unexpected things and come up. And that's why I want to have people just have an idea of how she manages her twin birth protocol. So twin delivery protocol for emergency or low resource settings. With twin deliveries, you are more likely to see premature babies, twin-to-twin transfusion, or TTT, breech presentation, cord prolapse. If a woman has a cord prolapse, put her in a knee chest position with her bum in the air. Sometimes the baby can even be born in that position if you have no other help or resources available, and the baby can survive. Placental detachment of baby B. So that's another reason, if you do have the capacity to listen to baby's heartbeat, once baby A is born, then baby B will be monitored continuously until baby B is born in most twin births, home births. Maternal postpartum hemorrhage is more likely. Cord entanglement and interlocking of twins, and note that these last two are very rare and only tend to happen with twins that are identical sharing the same sac, or if both baby sacs have ruptured. Okay, so now here's some information unique to twin deliveries. Because of the larger volume within the uterus, women giving birth to twins often feel a notable sense of relief when the bags of water are ruptured, especially for pushing baby A out. Okay? The interval between deliveries of the two babies can range from 1 minute to a couple of hours, with the average interval being 15 to 20 minutes. Usually the placentas are fused together, whether that be in identical twins or sharing one placenta, or whether that be in identical twins who share the placenta, or fraternal twins with two separate placentas that meet up as they grow, and they will detach together and come out together. After baby B is born, if the placentas are not, they will come out together after baby B is born, the second baby. If placentas, baby B is born, or both placentas may stay attached until baby B is born, after baby B is born. It is best to have a birth team of at least 5 midwives and assistants so that there will be enough assistance to help in the resuscitation of both babies at the same time if needed, while midwife maintains watch and care over the mother. Okay? Twin babies can change positions and or assume different presentations during the course of labor and delivery. Most commonly it is baby A, or baby B rather, that does the acrobatics. Because of the space made available for made available after baby A is born. Baby B's presentation can be unpredictable, although usually will present in either a cephalic head or breech bum presentation. And I'll stop there.